Dr. Doreen 𝗟𝗓𝗧 is the
Dr. Doreen is an expert in autism.
Doreen 𝗟𝗓𝗧'𝗦.
Dr. 𝗟𝗓𝗧.
Dr. Doreen 𝗟𝗓𝗧'𝗦.
Dr. Doreen 𝗟𝗓𝗧'𝗦 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. How long after giving a 6-year-old the B12 shot should we expect to see results? And they said, do we have to give the B12 shot to a child under the butt skin or just directly straight shot?
So I think you should be seeing results within the first month, honestly. And if you're not, you should probably go back and talk to the physician and figure out if you need to continue doing this. I mean, with the methyl B12 shots, they should have done some blood tests initially to be able to tell you whether or not your child actually should be doing this, because this is not necessarily a fun thing, although the needles are tiny.
Yeah.
So, and I think I think it's it's not a subcutaneous, I think it's intramuscular.
You have to do it, she's right that it's under the butt skin. You have to go from the side, not
in. Okay, so then it is subcutaneous. So that means you're going under the skin, not into the muscle. I think the reason they tell you the butt skin, a lot of parents I know used to do it when their kids were asleep even, right? Because it's hard to get your child to come and do this a couple times a week. So they would, essentially the child was asleep and they would very quietly go and do this and the child wouldn't even respond or react or wake up. But yeah, I mean, again, I know it's a very difficult and kind of an invasive procedure. So you should really see an effect. If you're not seeing an effect within the first month, go talk to the physician again.
And I just want to add that I want to make sure, like I said before, that it is a methyl B12, because you can get B12 just from your pediatrician.
Which is intramuscular.
And that's going to be a different situation.
Completely different. And the B12 would then wake your child up and make them pretty active.
There we go. What you really want, I would assume, with autism, the thing that we're normally talking about seeing a result from is a methyl B12 shot.
Yeah.
You have to get that from a compounding pharmacy. You have to have a doctor prescribe it. And often there's a mix that it will be methyl B12 and something else that your child needs. So you'd have to see a physician for that.
And let me tell you that you'll be able to tell from the size of the needle.
Oh, there you go.
Methyl B12 needle is tiny, and a regular B12 shot, the needle is relatively big.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.